Okay, this is for our cervical patients. When I have a person supine on a heating pad, we're going to always take off the old pillowcase, put on a new one. Make sure there's no stains on that. Preferably you do that even before the patient was in the room. But we want to make sure that this part gets the neck and then it goes on down the spine. So actually I'm going to have you lay down on your back, just right there. And if it was a patient, I would have them walk around the other side so they don't trip over that cord that actually is agile. Perfect. And I'll give you this so you can relax. So we're trying to get in a nice neutral posture. I'm going to lower this just ever so slightly. And then this heating pad is kind of unique. You press this to make it hot, and when it gets warm enough, you release it, it'll cool off. It's designed so that if you were to fall asleep, your hand would relax and you wouldn't burn. So that's the heating pad, and we're going to give that several minutes to get going. So when you read in the chart that we're doing scapular retractions, actually you could do that actively in this position by just squeezing the shoulder blades down and back like that. And you're pretty flexible there, so that's good. But that's one of them that we do. We also do an active chin retraction or neck retraction from there. So that's just something that somebody can do on heat or ice. When you see that we're assisting that stretch, some people, when they lay down here, their shoulders are really curled forward, in which case we would come over here and just apply some anterior to posterior force like that, and then take a big breath. And we're breathing through that stretch. So this is something that you can do, really for several minutes on each side, making sure that they're not getting numb or tingling in the hands. Again, your posture there is pretty good. When we go to the suboccipital release that you'll read in the chart, we're just putting the fingertips at the base of the skull back here. So we're just going to have you roll to the side, and then I'm just going to have my fingers right in there, applying that kind of pressure, have you relax. There we go. So that's the suboccipital release. We'll go from there into some manual traction, where we're just pulling at the occiput, releasing that. We could go ahead and put the head in the vise a little bit and pull a little bit harder. You probably feel that. Mm-hmm. Sometimes you'll feel it all the way down in the low back. While we're in there, I'll work these muscles out where I just get my fingers into the paraspinal muscles, working those back and forth to try to restore some cervical lordosis. I'll go in T1 through T3. Create some rotation in those areas. For C1, C2, we're going to go up into rotation, resist me, and relax. So we can do a little bit of contract, relax. For suboccipital, we'll do some combined stretching with eye movements. Look up towards me and then down towards your feet. Up a little bit. Wouldn't want aids to do this, or really even assistants, but we can do some side glides. This is more for the physical therapist, because that's an actual joint mobilization. We could also do some scapular depression, combined with a little bit of head motion there. We can do a contract relax with this as well, but that's just a little bit aggressive. So again, when you're reading this stuff and we have a patient supine, usually on a modality, these are the types of things that you see in the chart.